Wellness Foundation is here for you. Learn, thrive, stay strong, we rise together. For a healthier life, we'll walk with you. We are here for everyone and everyone. Oh, hey. Oh, take charge, live well every day, every moment. Diabetes Wellness Foundation is here for you. Learn, thrive, stay strong, we rise together. For a healthier life, we'll walk with you. We are here for everyone and everyone. Oh, hey. Take charge, live well every day, every moment. Diabetes Wellness Foundation is here for you. Learn, thrive, stay strong, we rise together. For a healthier life, we'll walk with you. We are here for everyone and everyone. Oh, hey. Oh, take charge, live well every day, every moment. Diabetes Wellness Foundation is here for you. Learn, thrive, stay strong, we rise together. For a healthier life, we'll walk with you. We are here for everyone and everyone. Oh, hey. Oh, take charge, live well.
It has God in the middle of it. Only problem is my mentor does not believe in God. So I was awarded with 2 weeks of silence. Then she said this. I haven't been to church since I was little.
Oh, hey. Oh, take charge, live well every day, every moment. Diabetes Wellness Foundation is here for you. Learn, thrive, stay strong, we rise together. For a healthier life, we'll walk with you. We are here for everyone and everyone. Oh, hey. Oh, take charge, live well every day, every moment. Diabetes Wellness Foundation is here for you. Learn, thrive, stay strong, we rise together. For a healthier life, we'll walk with you. We are here for everyone and everyone. Oh, hey. Oh, take charge, live well every day, every moment. Diabetes Wellness Foundation is here for you. Learn, thrive, stay strong, we rise together. For a healthier life, we'll walk with you. We are here for everyone and everyone. Oh, hey. Oh, Take charge, live well every day, every moment. Diabetes Wellness Foundation is here for you. Learn, thrive, stay strong, we rise together. For a healthier life, we'll walk with you. We are here for everyone and everyone. Oh, hey. Oh, take charge, live well every day, every moment. Diabetes Wellness Foundation is here for you. Learn, thrive, stay strong, we rise together. For a healthier life, we'll walk with you. We are here for everyone and everyone.
Hello, everybody. Thank you all for joining. Thank you all for joining. If you have just joined us, please put hello, everybody. Good evening. Thank you all for joining. So happy to have you join us in this year's World Diabetes Day 2025 celebration. Thank you for joining us. If you are joining us, let's know where you are, what country, what part of the world you are joining us from in the comment section. Put something in the comment section. We are happy to have you. Thank you very much. I'd like to welcome you if you're just joining us. Please put your location, where you're joining us, your name, and let's meet you in the comment section. Let's meet you in the comment section.
Oh, hey. Oh, take charge, live well every day, every moment. Diabetes Wellness Foundation is here for you. Learn, thrive, stay strong, we rise together. For a healthier life, we'll walk with you. We are here for everyone and everyone.
All right, thank you all again for joining. Let's know where you're joining us from. I'm so happy to have you. Put your comments in the comment section. Let's hear if you can hear me and you're part of us today. Please let's know where you're joining us from. We're about to start. We'll start in the next 2 minutes. So it's just some housekeeping, some introductions. If you don't mind just putting your location where you are, put it in the comment section. Do that right now. You're welcome. We're going to be discussing exclusively about diabetes, but we're going to be extensive with our discussion around diabetes and how it affects people of all ages. The theme for this year's diabetes, World Diabetes Day, is diabetes across all ages. So we are going to be understanding diabetes across all ages today. And we got somebody who would be doing justice to that, somebody who is trained and has got enough experience to be able to take us through, walk us through this subject matter. I'll be bringing him up in a minute. So I just want to recognize those who are joining us from Facebook, from YouTube. Please put a comment in the comment section. Let's hear from you.
Oh, hey. Oh, take charge, live well every day, every moment. Diabetes Wellness Foundation is here for you. Learn, thrive, stay strong, we rise together. For a healthier life, we'll walk with you. We are here for everyone and everyone. Take charge, live well every day, every moment. Diabetes Wellness Foundation is here for you. Learn, thrive, stay strong, we rise together. For a healthier life, we'll walk with you. We are here for everyone and everyone.
All right, let's get started. Good evening, everybody, once again. I believe you can all hear me wherever you are. Thank you all for joining. We're so happy to have you all again join us. We had this in 2023, 2024. Not exactly in this way. We've had it in different versions. But I'm so happy that this time around we are having it again. We're going to be discussing exclusively on diabetes and extensively as well on how diabetes affects people of different ages, from childhood to adolescents to young adults to older adults, and middle-aged adults even to older adults, and all the nuances and the different things to learn and to understand about diabetes at these different stages of life. I hope you are with us. If you are still with us, please put a comment in the comment section. Share this with your friends, and then we'll be I'll be more than happy to have you. Right, we're going to start right now. I'm going to be introducing my good friend who is here to help us understand and unpack this. Thank you very much, Pelumi, for coming on.
Yeah, thank you so much. It's so nice to be here, and
Yeah,
it's a pleasure.
thank you so much.
Yeah,
All right, so I know you, but I don't. I think we should just make this a formal introduction. Do a formal introduction first, and ask you to introduce yourself, uh, so people can be aware of who is. I mean, who they are interacting with for this webinar.
yeah,
Thank you.
yes. My name is Oluwapelumi, and I practice here in the UK as a diabetes specialist nurse. So yeah, that's it's about me. I've only kind of been in this role for roughly 10 months, but I can say I've learned a whole lot of things. Yeah,
Yeah.
that's it.
Honestly, if you look at it, it's not. I mean, I've also been around some of our diabetes specialist nurses, and it's
Mm,
really interesting. A lot of the things you get to learn them on the job is a
mm,
lot of practical learning, and that's
yeah,
what we are here to do. We want to
mm,
share those practical lessons that you get to learn, and whether it's 1 year or 10 years, is usually about how much of experience you've gathered from the
mm,
job, and the knowledge is never a waste. So let's get started on today's conversation.
yeah.
Uh, we are talking about diabetes. So when you think about diabetes, what do you like to? How do you define diabetes? How do you explain diabetes to people?
Yeah, I mean, diabetes explanation varies depending on the person who is suffering it, right? But the general definition I would like to give any layman person or any layman would be that it is a chronic disease, okay? And by chronic disease, I mean it's a disease that will not necessarily go away. I mean, I know we've heard about cases of like diabetes remission, and some people saying, "Oh, they are completely free from diabetes." While all of those things can happen, what we need to know that even though you're in remission, there's still that need for you to continually monitor yourself so you don't develop the complications, or so that the disease doesn't reoccur later in life. So it is a chronic disease that happens basically either when your body is resisting insulin, um, which we call type 2 diabetes, or when your body kind of destroys its own pancreatic cells, which typically happens in type 1 diabetes. So all of these eventually leads to high blood glucose, and which needs some form of medications or management to regulate. So that is what essentially diabetes means.
Thank
Okay.
you. Thank you
Yeah.
very much. We're going to start from that from the list and go progress from there. So let's pick it up from a situation where there is the body is destroying its own diabetes, and that typically is type 1 diabetes. And I'm aware that
Mhm.
happens more in children, in
Yeah.
their early adolescence and all that. So let's pick it up from there, and then we progress to the older adult.
Yes.
So what happens? What's happening to the individual at that time, and what do we need to be aware of? As anyone who is living with diabetes, what do they need to know?
Well, so are you talking about diabetes generally, not type 1,
No,
right?
no, type one diabetes. Now we're looking at type one.
Okay.
Because it happens to children and people. Well, I don't want to just say children because we are beginning to see some other interesting variants. So I wanted to talk about all those interesting things around the
Yeah.
type one.
So yeah, like you said, type 1, I mean, the major time, the times where we tend to see type 1 developing in people is at the young age. And then we've seen cases where it comes, in middle age. I've even seen cases where somebody develops type 1 at around 80 years. So, what to bear in mind in the development of type 1 is that it is not what you've done. Let's start from there. It's not what you've done to yourself. It's not as a result of your lifestyle. It's not because you've been sedentary. It's not because you eat so much sugar. It's just your body, it's your immune system all going rogue. And we see this kind of tends to be genetic to start with. But I think it's just been nice to put it out there that it's not what you've done to yourself. It's just your body, your immune system going rogue, destroying itself. And we tend to see these particularly in people with other forms of autoimmune conditions,
Mm,
like issues with the pancreas, or it can also be genetic. Say, for instance, if your dad has type 1 diabetes, or your parents or your siblings, there's a possibility that you would also come down with type 1 diabetes. And we also tend to see, I've also seen cases of like twins. If for very identical twins, there is a 50% chance that if one of the twins have type 1 diabetes, there's a 50% chance that the other one will have type 1 diabetes. So yeah, that's just the middle things to know about type 1. Yeah.
brilliant. It's interesting. So let's. I want to pick on one of the things I got. Somebody asked me some times ago about, um, and I'm aware you know about the viral connections, the
Yeah.
connection of viral infections, diabetes. Type 1
Mm.
diabetes in particular.
Yeah.
Do you have any information or practical experience around that?
To be honest with you, from my very few period of practice, or my short period of practice, I would not necessarily say I've seen anything like that. But what I know is that for type 1 diabetes, there are some things that can push you towards it, especially if you have it like within your body already.
Mm,
And one of it can include, illness, whether you're having some kind of a bug, or you're just sick, you are having an infection or something that can, affect the whole system generally. That
mm,
can be a trigger for type 1. But I wouldn't really say that I've seen a situation where like a viral infection, is triggering type 1 diabetes. But I
mm.
do know that this is like a theory.
There's a
I've
theory around it, yeah.
very
Yeah,
around.
and that's interesting as well because there's
Yeah.
a lot of theories that are not very common, but when you
Mm.
get to see them, it's just like, wow, so this thing does really exist.
Yeah.
So that would bring us to understanding how people can get to know that they have type 1 diabetes because
Mm.
unlike type 2 diabetes, we don't, we may not be able to prevent it because it's the body, like you said, going rogue. So,
Yeah. Hmm.
how do we prevent it if it's possible? If there is any new study around it, I've not come across one, but
I know
I've come
that.
across some. Yeah, go on.
Yeah, I know there are some things. I've read some things about some kind of like a vaccine that you
Mm,
can take to prevent type 1 diabetes, but all of this is still in theory. I don't
still
think that.
work in
Yeah, I
progress.
don't
Yeah.
think there's a conclusion. There's a it's not concluded yet.
Mm,
The research is probably still ongoing, but I don't think you'll be able to prevent it. This is an autoimmune condition, right? This is the body destroying itself. I don't think the way you can stop it from happening. But I do know that as part of the treatment of type 1, there's something we call like pancreas transplants. People have pancreas transplants and some other kind of surgical intervention, to replace the pancreatic cells or the pancreas that's been destroyed. So that's all I know, but I don't really know. But we can only find out when the result of the whole
result of
of
yeah,
the
honestly, I came across one from the Diabetes UK. It's not about prevention, but I think they are trying to use some artificial intelligence to
Mm,
sort of track. I think they did a long study of tens of thousands of people who have had type 1 diabetes, and they are trying to see if there are some symptoms or signs that they showed before those clinical symptoms really
Mm,
do manifest. And I think they are working on that. Like you said, there's a lot of work ongoing. Yeah,
yeah,
but just to put it out there that at the moment it's not something we can prevent.
yeah.
So how do we know? Does it then mean that we have to wait for symptoms to show?
Unfortunately, yes. Well, there's a way you can track those symptoms before it gets severe, right? Most of the type 1 cases are usually diagnosed when the person or the sufferer is already in DK, which is like a diabetes complications, particularly for type 1 diabetes. But we don't always have to get to that point, right?
Yeah.
There are signs that somebody can begin to show before you get to that point, and these signs are just basically signs of hyperglycemia. Okay, and those signs can include, I think, the one that I would like I usually tell patients is weight loss.
Mm.
Weight loss is it's a very important sign of hyperglycemia.
Sorry to
And
cut in, and this weight loss is in children too now.
yes, yes, it happens in
Mm.
children. Yeah, because the pancreas, the autoimmune condition don't just happen suddenly. It's not like in a whole day, then the whole pancreas is destroyed. While this can vary from people to people. For instance, in LADA, which is a type of diabetes, the 1.5 diabetes,
Mm.
it actually happens gradually. So at
Mm.
the early stage, the sufferers are usually diagnosed as type 2 diabetes. And then when it gets to that final point where when almost all the pancreatic cells have been destroyed, then they now get the diagnosis right. Okay. So like I said, it varies. The destruction varies from people to people. While some people's, destruction can happen very suddenly, some people will take about 2 to 3 months before everything gets worse. So in that period, the person will begin to show signs of hyperglycemia. And the big one is weight loss. And parents should usually look out for this in their children. And when you realize that their clothes is not fitting as it used to do, when wristwatch are getting loose, when you just know, sometimes, parents, when you see your child or your children, you just know something is going wrong.
Mm. That's
Okay. So
motherly instinct and
exactly,
fatherly
yeah,
instinct.
exactly. There's that instance that you just know that something is not right with this child. And you know what makes it worse? There is a way young people tend to cover up things. For
Mm.
instance, if you see a child that is sick, before it would have gotten to like the extreme point. That's because we are still young and vibrant. We know how to kind of cover up things.
Mm.
And, sometimes children don't want to be in that position where they are looked after,
Yeah,
where they hospital bed and stuff
honestly,
like that.
honestly, I
So
can, I can, I can attest to that. My
exactly.
little toddler, even when you're expecting her to be staying somewhere because obviously she's unwell, and
Yeah,
then she's still jumping around. You would think that
exactly.
I thought you were well. If this had happened to an adult, the adult should be bedridden
Exactly.
right now. But that's the
Exactly.
resilience that is in them, and that's beautiful. So,
Exactly.
what kind of children treatments do they get on the surface? I mean, I know this also varies from economy to economy, country to country, people to people. In the UK, we have it a lot different from Nigeria and then even the US and all that. But
Mm,
what are some of the things that people should be aware of when treating
treating
diabetes? Type
diabetes.
1, yeah.
So yeah, treating type 1 diabetes. So there is no way, there's no escape to the use of insulin. Okay.
Yeah.
There is no tablets that you can use to treat type 1 diabetes. I think what people tend to get wrong is that they don't really know what exactly is going on with them. And that's exactly what we have just explained. It's that the pancreas is not producing either no insulin or very small amount of insulin. Okay. So what your body needs is like a replacement. Okay, your body needs a replacement for the insulin that is not being produced at all, and the way to get it is by injecting insulin. Okay, there we are beginning to see cases of people who are needing some extra form of tablets to manage their diabetes, but those tablets are not to completely eradicate the need for insulin. And those tablets can include like metformin, which is a medication typically used for type 2 diabetes. But we are seeing cases, I don't know whether I should go into this one now, but we are seeing cases where people are needing medications like metformin because because of the resistance they are building to the insulin they are getting extra. So
Mm.
medications like metformin will work. in order to help you utilize that insulin you're having to inject externally. So, and there are other tablets which I don't want to go into, but the
Mm.
primary management of type 1 diabetes is insulin. Okay.
That's brilliant.
Yeah.
I wanted to flag the question up here, but before I flag it, Whitney Boateng, thank you for putting that question there.
Mm,
He was talking about how we can detect it, but before I flag it up, and we can probably just touch on that question, I want
mm,
us to speak to what are the nuances that people living with diabetes, type 1 diabetes, children and parents who are caring for them, what are those things they need to be aware of, especially with the management.
mm.
um that I think that's one thing that
Y-
you want to badly tell people living with diabetes, that two
Yes,
things that you
yes.
need to
Thank
know.
Yeah, thank you for that question. Because when I see patients, especially with type 2 diabetes, and they are very young, I usually take it as an opportunity. First of all, because they will be able to understand, the information I'll tell them, because they are young, and most of them are still in school. They have that brain to be able to capture all the things I'm telling them, as opposed to old adults where you have to struggle and struggle to
Mm,
try to educate them. So one of the things I try to tell them is that they need a very good control, right? And I'm sure you agree with me on this.
mm,
Need a stringent control of their blood glucose. We can't settle for less. Okay, so you need to keep your blood glucose in a tight control. All right, and I tell them this in order to avoid complications, because um, being diagnosed of diabetes at such a young age means that they've got an extended period, all right, of time to live with that diagnosis, or to live with diabetes. And we know that all this complication actually happens depending on the period you have been exposed to hyperglycemia. So if you are young, that means you need to get your control at this early age. You need to get it right at this time. So I try to educate them, give them all the necessary education they need to be able to independently manage themselves. All right. And that's vary from how they can titrate their insulin, how they can make decisions, what they need to know, seek their rules, and a whole lot of things. So this is one of the things I always want to press into them.
and that's very interesting because with type 1 diabetes, there's a lot of self-management that goes into it. So
Absolutely.
I have, in my own interaction with some of our patients and that, what usually happens is once in a while the thing goes up, but because there is no symptom, they just neglect it and say, "Oh,
Absolutely.
I don't care." And
Mm,
and honestly, it's draining. And,
yeah.
and you would agree with me, it's draining. There's even in the concept of diabetes distress. So there's
Mm,
that, especially with
yeah.
a child that doesn't even that is just coming. It's like you're taking their childhood away from them. But
Yeah.
again, you understand that the goal at the longer term is to prevent complications. So
Yeah.
all those spikes in, and let me just put it there, does it then mean that all those spikes in
Mm,
blood sugar
mm,
consistently happening that way, even when there are no symptoms, when it looks like the person is still okay, are
mm.
they in some way contributing to the development of complications in the future? Is that what you're saying?
Yeah, that can contribute, especially when it happens repeatedly for a long period of time. That can happen. And also to say that when they have these spikes in blood glucose, and they just treat it as normal, what is possibly happening is because their body has been exposed to such high blood glucose, and then they just build like normal, they just cope with it, if you know
Yeah,
what I mean.
coping. Yeah, that's the word.
Yeah, yeah, they just cope with it. And it's very funny when I see this kind of people, and then they begin to get their control right. And even at a very normal blood glucose, they are showing signs of hypoglycemia,
Hmm.
showing signs that, oh, my blood glucose is running low, I need to bring it up, and stuff like that. So, and this is the reason why we tend to take it gradually. So we are not
Hmm.
crash the blood glucose down. We're going step by step, all right, until they get the control right.
Right. I think we've talked extensively on type 1, but this
Yeah.
person is saying if this is also genetic, if there is a gene that can be detected in children to detect diabetes early on, I
Mm.
think it's true, right? There is a genetic side to it, like
Yes.
we said.
Yes, absolutely.
But yeah, do you want
Yeah.
to talk about that?
Yes, there's a genetic side to it, and in fact, there are some diabetes that are purely genetic. Okay, so it's not because your pancreatic cells are destroying itself. First of all, I'm not, as far as I know, I'm not sure there is a way you can genetically test whether somebody would come down with type 1 diabetes. All right. I think the only way to know is to consider the risk factors. And one of it is the genetics, whether, whether your parents or your father has diabetes. All right, look into those ones, or whether you have autoimmune conditions. So if you have
Mm.
some autoimmune conditions like thyroid disease and stuff like that, that can be an indication that you might have type 1 diabetes. Now, there are some kind of diabetes that are purely genetic, and one of them is MODY. Okay, so which is called maturity onset diabetes in the young. So that's purely genetic. You can do genetic testing for that kind of diabetes. Okay,
That
so
makes sense.
yeah,
Sorry, I don't want to. I don't want us to go too far into Modi
yeah, I know
because I think
where
if we progress from here, we might still jump. We might still get there.
yeah,
So
absolutely.
if you want, you said type one. We talked about type one. There's type 1.5 before we jump into type two.
Yeah.
That type 1.5
Mm.
ladder. Have you seen those kind of cases before? What does it look like?
Yes, absolutely. I think I would say the only difference is the age. Okay.
Mm.
Type 1 is purely in young people, in the young, the adolescents and stuff like that. Now, a man of over age 80 having type 1 diabetes, you know that that's definitely ladder, especially one who has been previously diagnosed as a type 2, which he would be wrong, and then over the course of the years, he's now being told he has type 1. So that that is ladder. All right.
Okay. No,
Yeah.
sorry. Something is coming to my mind now. There
Yeah,
is something some patients used to say, and we have always tried to disabuse their mind around. They say that they used to have type 2 before, now they have type 1.
exactly.
You
So
know
that's
that statement?
that's
Have
simple.
you
Yeah.
heard that from your patient before?
Absolutely.
I've interacted with some of our diabetes. The man was like, he had type 2, and he said, I said, well, I understand maybe you are saying you have now been started on insulin, which is
Yeah.
common in type 1, but that's not type 2 becoming type 1. Actually,
Yes.
it is a misdiagnosis of type 1.5 from the early
Yes.
on the
Absolutely.
onset of it.
Yeah.
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 I hope everyone
And
understands this.
yeah, yeah. To be honest, it's we. My aim is not to confuse anybody here. I think maybe it would be nice to like define these terms
Yeah.
because we'll keep saying them over and over again during throughout the course of this.
Mm-hmm.
So I think, do you reckon it would be nice to
Yeah, yeah,
like?
makes sense. Go ahead, please.
So now, like I said, diabetes is either your pancreas is being destroyed by your body cells, which is type 1, all right, and that happens in autoimmune condition, or type 2, your body is building up resistance. And with type 2, we tend to see this with people with, abdominal fats, obesity around the central region of the body. All right. And we usually define this by your BMI. All right. The BMI tells us like the overall weight in your body, but we know that the major thing to look out for is that weight around the belly. So you can tend to see somebody who looks like me, and then the belly is as big as this. You wouldn't, if you look at the BMI, it might not be a lot. But then if
Mm,
you look at that person, you know that okay, this the
something.
central adiposity here. So it's not just the BMI. I said all of that to to explain that it's not just BMI, but it's the weight around the belly. All right. So now type 2 diabetes happens when your body's building up resistance to the insulin you're producing. All right, thereby resulting into hyperglycemia. So that's type 2, right? So now I hope we now understand the difference between these two
Mm-hmm.
diabetes. So now we're going, as we journey into the discussion, we'll be saying other forms of diabetes that is different from these two types of diabetes. So we tend to use the binary classification because either you're ladder or you're MODI or you're whichever one you are, your management plan will either fall into type 1 or type 2. Okay, so it doesn't matter. Sometimes I usually don't even want to bother trying to dig deep into the patient's diagnosis because it's either you have insulin or you have tablets. So it's as simple as that. Okay.
Honestly,
So
yes. It's
yeah,
either you're titrating insulin or you are
yeah,
managing it with that. It's true. It's true.
exactly. Exactly.
For the sake of patient education, then maybe
Yeah.
that's where we just come in with just be mindful of well, at the end of the day, just make sure you understand that this is the situation now. You'll be needing insulin,
Mm,
regardless of whatever the diagnosis is. This is
exactly.
what we are doing for you, and this is how we are managing it at the moment.
Yeah.
Yeah,
And sometimes you don't even know the diagnosis at the start.
interesting.
You don't even know. But what all you know is that your blood glucose is so high that you need insulin.
Yeah.
Okay,
Yeah.
so yeah, with something we don't just really want to bother about, digging deep and all of that. It's just getting the blood glucose right. That's all we need.
Makes sense. Makes sense.
Yeah,
So when somebody now has been diagnosed of type 2, we've managed to speak to type 1 and type 1.5, even
yeah,
though we are trying to dodge the whole terminologies. But let's focus on the real deals now. The type 2, which is another very common one, which is the most
yeah,
common actually.
absolutely. Yeah.
Um, there's already a lot of information around type 2, but from your experience and practice, what are some of those things that people need to know about type 2 that they
Yes.
really need to understand about it?
Yeah. Thank you. And like I said, for type 1, type 2 is also almost the same. It's not what you've done to yourself. Okay. There are many things involved. There are so many things involved that is pushing you towards type 2 diabetes. Okay. And the one that plays the major role is genetics, right? If your parents are type 2 diabetes, there's a high chance you would be. And this genetics is also kind of linked to obesity and high BMI. Okay. We can see, like, we know that high BMIs tends to run in the family. It's something that's very obvious, right? Nobody just develops a high BMI by his or our own self. So it is not really what you've done. It's just something that is present in your genetics. So there's you can now decide to take action, right? We can then decide to take action by watching your lifestyle, avoid being sedentary, watching the kind of food you eat, the diet, not eating food that has a very high glycemic index. And by that I mean food that will quickly release glucose into your bloodstream. So watching your diet, eating healthily, basically making sure you're eating healthy, right? And not being like people like us that we just eat whatever eat whatever we see. I'm sure if I had the genetics for type 2 diabetes, I'll probably come up with very high blood glucose. So
I love the points. Sorry to interrupt you, but
yeah,
I just want us to quickly move on. But I love the fact that you are emphasizing on the genetics of it because again, a lot of people beat themselves when they have type 2 diabetes, and that's why I say sometimes the problem is not that you having type 2 diabetes. Honestly, in my
mm,
advocacy, in my patient education and everything, my goal nowadays is just try and prevent complications. Honestly,
exactly.
because whether you have it or not, there is so little you can do to prevent it. Sometimes, many
Yeah,
times
absolutely.
it just comes. It
You don't
just
have
comes
control
because of
over
the
it.
genetics of it. So,
Yeah.
so yes, we understand food, we understand this. For those who are now managing diabetes already, type 2 diabetes already, let's
Mm,
talk about some of those things they need to know.
mm,
Yes, thank you, Whitney, for that response. Thank you.
yeah.
So let's talk about what more things they need to know uh, around type 2 diabetes, especially with regards to uh, preventing complications, because like we said, that's now the goal if you've now
Yes.
got type 2 diabetes.
Yes, yes. I think what they need to know is, first of all, to know that everything they're doing is towards the goal of preventing complication, because that complication is what makes it difficult to manage. That's exactly what makes it difficult to manage. And the complication, it starts from the very little things, from simply having lipos around the injection sites,
Hmm.
you know, to then getting to the point where you're having kidney,
Yeah,
disease.
let's explain lipo to our friends.
You said what?
Let's explain lipo.
Oh
Lipo
yeah,
to our
sorry.
friends.
Yeah, so lipo it means lipohypertrophy. So it means like the swelling around your where you're actually giving insulin for the type 2 diabetes that are on insulin. It's like a fat, tissue that collects around the place where you're injecting. So if there's that swelling there, the insulin you're injecting might not be absorbed, you know,
Hmm.
so thereby making the whole process and the whole management difficult.
Hmm.
So it's just really everything we're doing is towards the goal of you preventing complication, because like I
Hmm.
said, what makes it difficult, right?
Hmm.
And what we really want is that your blood glucose is in that tight control, right? And I think it's best to also define what we mean by tight control. For a normal person, your blood glucose will usually sit between 4.0, and I'm using millimoles now because that's what I'm used to, between 4.0 to 7.8. That's for a normal person. Okay. This tight control can also depend on what you and your diabetes nurse or your healthcare professional agree on. All right, because we also need to factor the fact that some people might be frail, some people might be can be prone to very bad hypo. So we might want to keep you slightly on the higher. So right, but essentially, studies have defined that an HbA1c of about 53 millimoles, all right, per mole would be enough for you to avoid those complications.
Mm.
So yeah, so if you can get that right and sustain it, not just for 2 years and then the next few
You
years,
go to tell me to the next year.
yeah, sustain it, then you will be preventing all these complications. All right. And also attending regular screening, very important, right? Your annual screening to check your eyes, to avoid, diabetes affecting your retinal, checking your kidneys, so that you're not having kidney disease and stuff like that. And also checking your nerves ending like the feet to avoid neuropathy and stuff like that. But if you can just play your part and make sure your blood glucose is right, leave the rest to the healthcare professional to sort.
Mhm.
Okay.
Yeah, yeah, that's brilliant, and
Yeah.
that generally speaks to type 2 diabetes for most people who are at the young adults.
Yeah.
Is there anything peculiar to young people with with type 2 diabetes and older people with type 2 diabetes? Is there something we should be worried about for these age groups?
Um, so for young people with type 2 diabetes, to be fair, this is kind of like a new development. It's like the human race is getting more technical year by
Oh,
year, because type 2 diabetes tend to only happen in people like the middle age adults, right?
mhm,
We don't tend to see it in adolescents and stuff like that. But we are increasingly seeing people being diagnosed with type 2 diabetes at age 18. And in fact, you would think that is type 1, but it's actually type.
mm,
But the way
mm,
you would know easily is, first of all, they are not in decay. They are not having that decay where you don't say, oh, this is type 1. And then you will see that these people tend to have this obesity we're talking about. Okay. And it kind of, if you then look at into people, if you look into people's family history, or look at people's, family cycle, you see that it tends to run in the family, right? Say, for instance, a woman who is type 2 diabetes gets pregnant, does not get her control right during pregnancy. She gives birth to a child, a macrosomal baby, and that means
mm,
big. It
mm,
simply means big baby. Now, macrosomal baby can tend to develop type 2 at a very young age.
mm.
So, this is where you then need to break that cycle by getting it right. All right. So by getting it right. So that's just it. Nothing changes in the management plan. It's the same, but it's just, you know, age of presentation,
Yeah.
basically.
Yeah, thank you again for that. So,
Yeah.
I want to again spotlight Whitney's because I don't want us to wait to the end before we answer questions. I just want us to have the conversation as we go. So he's
Yeah.
asking something on the screen. He says, very interesting point about lipo. What advice do you have for injecting insulin if you do not like needles or you are scared, especially young people?
Oh, okay. To start with, for injecting insulin, first of all, the advice we give patients is to make sure you're rotating the injection sites. And I use the word rotate, not alternate. Right. So if you alternate, you're just giving left and right, left and right, left and right. You would have lipos like that. But for rotate means you can divide your belly into 4 quadrants. Okay. Choose a quadrant, say for a week, and inject. Make sure you're not going into the same place. Choose the next quadrant for another week and inject, and then go like that, like that. Now, for people who are scared of needles, there is something in the UK, because I wouldn't want to generalize this. There's something we call an iPod. So an iPod is a small device that can sit in your injection area, okay, and basically you still feel the pain, right, when putting the iPod in, but then when you're injecting subsequent times, you wouldn't be feeling the pain because the needle will be going into that iPod area, and you have to change the iPod area every 30 days and
Every
stuff.
3 days.
So you
So
still have
it's
to inject.
like it's 3 days,
But
3 days
exactly,
of
but yeah, but you
yeah, but
wouldn't.
I think it's better for somebody who is really scared. At least
Yeah.
there's
So
some
yeah,
bit of
you
allowance
can
for.
you can talk
Yeah,
to a healthcare professional about it.
yeah,
It's called an
yeah.
iPod.
Honestly, yeah, that's important. I think you need to mention it to your the team managing you to say that I'm really struggling with insulin injections and everything, because we need to also be aware of the fact that if you are struggling to take insulin, then there is a higher risk of all the complications setting in, because you may not want to even take your insulin.
Yeah,
Right.
and sorry to cut you short. She also mentioned something important. She said for young people,
Mm-hmm.
because these are real struggles young people face. They don't want to, especially they don't even want to be seen outside the public injecting insulin.
Mm-hmm.
You see that? So, and these are very difficult conversations we need to have with them. How that this, I wouldn't want to say this has come to stay, but this is a real situation, and you need to manage it. Thankfully, there are technologies now in diabetes where you have insulin pumps, that can just continually deliver insulin into your system by watching your blood glucose, and the system just sort of automatically decide the amount of insulin you need to take. But again, this is not some decision your healthcare professional will just make and give it to you instantly. Before you get there, you would have to be given injection, you have to inject, and the whole process is just quite long. All right.
Mm-hmm.
But you can get to that point where things would be easy. But I
Mm-hmm.
mean, it's a new thing, it's a disease. The start is not going to be easy. It's going to be a bit rough, right? But then you get to that point where you just cope with things.
Oh, thank you so much. Thank you so much.
Yeah.
I'm really loving how we're able to answer and respond to the questions and attend to real life issues. And that was why
Yeah.
I was mentioning to you. I don't want us to have it like a
Yeah.
didactic
Yeah.
system. So I think we are making progress. We've spoken extensively to how people who are a bit younger can manage type 2 diabetes safely, and even that some of the tips applies to type 1 diabetes as well. But can we
Yeah.
now a bit move closer to the middle-aged people and
Yeah.
maybe then stretch it further to the older adults? And there are some things they need to know, even from the point of prevention down to them managing it well.
Okay. So preventing diabetes for the middle age, first of all, I think the middle age folks need to know that they are at risk for diabetes. All right.
Mhm.
And I'm talking about type 2 here now, right?
Yeah, type 2, yes. We're trying to
So
explore type 2.
yeah, so they need to know some things that can put them at risk. And the first one is obesity, like we said. Okay.
Mm,
Second is genetics. If one person has it in the family, there's a possibility, right? So the
mm,
next is PCOS, especially for women. Women with PCOS can develop type 2 diabetes. The reason being that the same metabolic process involved in PCOS is kind of the same thing that happens in type 2 diabetes. Okay,
mm,
so that's another one. What else is there? If you've had gestational diabetes previously, there's a possibility that you have type 2 diabetes. And then your ethnicity also matters, right? People like the Southeast Asian folks or Africans, Afro Caribbeans, and stuff like that, they are at higher risk of type 2 diabetes, even at this lower BMI. You can see how when we talk about it's nothing you've done, right? Even just
mhm.
being Afro Caribbean can put you
Can
at
you
risk.
imagine? Can you imagine just because you are from Southeast Asia or
Exactly. Exactly. So all of these things are things to bear in mind, and knowledge is not just everything. You then need to take actions. And one of the way you can take action now is by testing, going to your healthcare professional says, it looks like I have all of this risk. Can I get tested? Check your blood glucose, make sure you're not type 2 diabetes. Okay. And if you're not, you might want to, carry on checking all these things to make sure it doesn't happen later in life. Because
yeah.
type 2 it will just be there, and then you get to that point where your body can cope again. Because like I said, it's resistance to insulin.
Mm,
Your body is resisting the insulin, but what your body then is doing is to produce more insulin to overcome that resistance.
mm,
See that? So over the years, your body will get tired, and then the pancreas won't be able to produce more, and then you get to the point where you begin to manifest the symptoms of diabetes. And then if that lingers for a longer period of time, your pancreas will not even be able to produce any more insulin,
anything.
into needing insulin.
Mm. That's
So
that's really
yeah,
interesting, and thank you for that very
yeah,
clear explanation. Yeah,
mm,
so so my whole addition to that would be that for those of us in the UK and even any part of the world, there is a risk assessment tool that the Diabetes UK has
Yeah,
they use.
yeah,
So
absolutely.
if you even just have that information and just take it to your GP, it can help to just kickstart a
Yeah,
kind of
yeah,
conversation. Even from any part of the world, you can do it and just know your risk.
yeah.
I think it
I
was
think
two
it's the
years ago last
Finnish.
year.
Is it
Yeah,
the Finnish? I think it's called the Finnish risk factor score or something.
yeah.
Yes.
This is the one I actually. So there is this risk score.diabetes.org, the one on the website of the Diabetes UK.
Okay.
This is the one I generally subscribe to because again, it's the UK
Yeah.
guideline. Um,
Yeah. Yeah.
but I
Absolutely.
think it was adopted from the Finnish study you talked about. I don't
Yeah.
know. I don't know. I don't want
Yeah.
to confuse anybody. So
Yeah.
yeah, so that's that. So
So
we
sorry.
then
Before
just
we carry on, somebody asked about injection. Whitney asked about injection and what to do. If you can put the name of that device, I said iPod. So
okay.
it's spelled
What
I
HIPORT is it?
no IPORT.
IPORT.
Yeah,
So
that's
that's
the device.
is that a device?
Yeah. Yeah.
So how do we describe as a device for injecting insulin, right?
Yeah. Yeah. So you just need to speak to a healthcare professional about it, and they'll be able to guide you on
Yeah,
it.
that's good. That's good. So I believe he's still online with us. He's still with us. So he probably has heard that, and I'm just gonna pop that in the comment section as well. So let's begin to round up with the older adults.
Yeah.
This set of people.
Mm,
So before we go to the older adults, sorry, I'll just mention this again. Anybody who does the risk assessment will come across this, but the age range, because when we talk about older adults, middle age,
mm,
some people might be, where am I? Where do I fall? You know. So
mm,
let's make it clear for people who should be concerned about type 2 diabetes, especially when it comes to doing that self risk assessment. What age
mm.
are we looking at? Some people say 35. I don't know if that's what you know from what you do in your
Some people
practice.
say I've seen 45, 40, but to be honest with you, I don't at this point, I don't think there's any age. At this point, I don't think
As early as possible.
exactly as far so when you begin to see all these symptoms, you have these risk factors, just speak to a healthcare professional. Okay.
Yeah,
Get tested as soon as possible.
yeah. So that's it. So let's talk about some of those peculiarities of managing diabetes in
Hmm,
older people.
hmm,
Again, if there is anything to educate or to
hmm,
say to them about prevention of it, or even
hmm,
identifying it early,
hmm.
in older people. I know, and by this I mean people that are 60, 65 and above.
Yeah, yeah.
So let's talk around
So
that
I
age
think
group.
prevention is just the same. Okay, we've spoken about prevention in the previous age bracket, but one of the things I think in this age as well, it's quite difficult,
Mm,
and I will tell you why. The first
mm,
is polypharmacy. All right,
mm.
people in this age are probably already taking so many medications, and they don't even want to be burdened by an
Well,
add-on.
tell me about it. I have them all.
Yeah,
I see them every day.
yeah, and again, many of these patients would probably be suffering from other disease conditions or other chronic disease, maybe, or even other disease that are actually kind of part of diabetes,
Mm,
because diabetes can be part of what we call cardiometabolic syndrome, all right,
mm,
and that includes kind of many disease like hypertension, high BMI, dyslipidemia, all of those things. So these people might have already been suffering from these things before they now, before they are now told that they have type 2 diabetes. So all of these things makes it very difficult. All
yeah,
right. They probably have less options of medications, um, you know, and even some of these patients might not really even have social support. Okay.
mm,
It might even be difficult for them to remember to take their medications. Some of these people already have dementia. You see how so it's kind of difficult to manage for them. So I think one of the things to emphasize for them is social support. All right. So when we diagnose them with diabetes, we are making sure that their next of kins or the relevant significant other is involved. We're educating them alongside, and we're also trying to emphasize medication adherence to them. Okay, so that they just go home and just neglect their medications and all sort of things. So yeah, but again, I think in this age group, what I've realized is that many of the people with diabetes in this age group are already needing insulin. You see that?
Yeah.
Because
They
I said
already
many
what?
of
Sorry?
they're already needing insulin. They're already requiring
Okay.
it because it's been such a long journey, all right,
Mm.
from young age up until older adult age.
Mm.
All right, the body has fought and fought and fought and fought and
Mm.
fought, fighting the
Thank
resistance
you.
to the point where their pancreas is now tired and not producing any more insulin. So many of the people in this age already need insulin, and we just need to have that conversation with them. That's okay, right? You need
Mm.
insulin, right? And important, and most importantly, involve their relevant,
Mm.
their significant order in their management.
Mm.
Basically, yeah,
Wow, thank you so much. Like this has been a lot of very rich conversation we've had. I mean, very
yeah,
helpful as well for anyone who is currently living with it, for those who are looking after those who are living with it, for those who are also looking to prevent diabetes. Like
mm,
we've said, at the core of everything, we're saying that there is a genetic predisposition that
mm,
many people who have it have already got. So that genetic predisposition is what ultimately causes the most people to have diabetes, and because of that, many times prevention might seem almost impossible. But whether
mm,
it is impossible or not, what you want to focus on is early detection, meaning that you get checked, you know your risk, and
mm,
following up on that is getting treated as quick as possible. Depending on where
absolutely.
you are in the world, you can always find treatments and help. I want us to just summarize all of this. I remember in my own personal way, I used to have it like A, B, C, D, and E of
Mm.
diabetes management or control or what everybody needs to know about diabetes. So I say A is, honestly, I can't remember everything,
Yeah.
but we just juggle memory together. I know A is A1C. So anybody who is having diabetes should be mindful of their A1C, right? And you talked about A1C. What was the safe place to be with A1C for preventing
So,
complications again?
yeah, 53.
Yeah,
Okay.
so
For
53
people who have
milligrams per
diabetes, yeah.
for people who
So
have diabetes.
yeah,
Yeah.
53 or less, you should be safe. All
Mm-hmm.
right. Yeah.
So the other thing we generally talk about, I also talk about is blood pressure. That's the other cardiovascular, the
Yeah.
connections they have with cardiovascular issues. So what do you have to say to that? Is there something they need to know
Yes.
about that?
Yeah. I mean, diabetes can affect your blood pressure, and
Mm-hmm.
because with diabetes, we especially type 2 diabetes, we tend to see people also having dyslipidemia, and
Mm-hmm.
that's with your like your lipids and
Mm-hmm.
stuff like that, cholesterol. Yeah.
Mm-hmm.
So now, so blood pressure, if you have a high blood pressure, that puts you at risk of having this diabetes complication. So um, you are getting your blood glucose right, you're getting your blood glucose in right control, but is your blood pressure also right? Okay, is your
Mm-hmm.
lipid also right? So all of these things also affect, right? We should have mentioned this actually. So your blood pressure, your lipids, and all of that, and some other things, like for instance, if you smoke, that can also put you at risk of diabetes complication. If you take alcohol, that can put you at risk of some complication or even make your management difficult, because I think it would be safe to put it out there that alcohol, if you take a lot of alcohol, can actually make you diabetic. Okay,
Mm-hmm.
because alcohol can cause liver cirrhosis, can cause pancreatitis, all right, and leading to secondary diabetes, which is the other one we've not spoken about. So if you take too much alcohol, that can also put you at risk of diabetes. So now smoking, your blood pressure, all of this can affect your diabetes management and also put you at risk of complication. So I think guidelines say if your blood pressure is between 130 or less, that's a safe place to be to avoid diabetes complications like diabetic retinopathy, kidney disease and stuff like that, neuropathy and stuff. So yeah, it's important that you speak with your healthcare professionals and make sure your blood pressure is checked, and you also do things to keep your blood pressure in good range, like avoiding diet that has a lot of salts and stuff
Mm-hmm.
like that. So,
Yeah, thank you. So you have
mm,
actually mentioned the first one. We talk about diabetes A1, I'm sorry, A1C,
Mm.
HbA1C, talk about BP. Then the other
Mm.
one I was going to say cholesterol, which you've talked about.
Oh,
You've
okay.
also talked about the drugs for generally CVD, that's cardiovascular risk
Yeah.
reduction. Some
Yeah.
and that the doctors will always talk about that. I think
Yeah.
E and you've actually mentioned it. E is exercise. So we'll talk about that. The other one is supposed to be screening for complications, which you talked about. People
Mm.
going for a yearly screening for
Mm.
the different complications, kidney, retinopathy, and their foot.
Yeah.
We talked about smoking and self. We'll talk about self-management. So that acronym is A, B, C, D, E, and S of diabetes care generally. That's the one um, I'm trying. I used to like guide
Yeah.
my conversation with
Yeah.
generally for everybody. But we've not. I would just go silent a little bit so we can touch quickly on some two important ones. We mentioned it
Mm.
in passing. Diabetes in pregnancy and secondary diabetes, especially steroid induced, the one that comes from pancreatitis. Can we just touch on that for 1, 2, 3 minutes and then we will
Yes.
start to round up?
Yeah. So to start with, diabetes in pregnancy, gestational diabetes. So it is another way your body will tell you that you might be at risk of diabetes later on in the future, and there are several risk factors that can put you at that can put you at the risk of gestational diabetes. And like we mentioned before, your ethnicity, your ethnic group, family history of diabetes, if you have PCOS, your age can even put you at risk, and your BMI. So all of these things can put you at risk of gestational diabetes. And like I said, gestational diabetes is just your body giving you an early warning that
Mhm,
you might be at risk of diabetes later on. And the reason why it is showing up as gestational diabetes, or the reason why your blood glucose is going high at the period of pregnancy, is because of the hormones in pregnancy. So all these hormones that help to regulate, the placental wall and all of that, all the hormones involved in pregnancy can increase your body's resistance to insulin. Okay, so if you're already having a little bit of resistance and your pancreas is managing and trying to fight and push for more insulin, then you get pregnant, that resistance increases. So when that resistance increases, then you tend to have hyperglycemia. So I know we for pregnancy we usually want to be very very tight with the control. Okay, so for pregnancy, we usually want the HbA1c to be less than 48. So we even
mhm,
tell patients before pregnancy that hope your HbA1c is good. If it's not good enough, would advise you that you be on contraception. All right. So it's not just for it to be good before pregnancy, but it also needs to be well controlled during pregnancy. And
mhm,
so we normally advise a fasting level of either 5.3 or less. Okay. And postprandial, 2 hours postprandial blood glucose of 7.8 or less. So
mhm,
that is what we want for pregnancy. All right.
mhm,
And for any diabetic patient who is planning pregnancy, speak to healthcare professionals, make sure your HbA1c is good. Why? What will happen is that if it is not good, there's a tendency that you give birth to a macrosomal baby. All right. And then a macrosomal baby, then you basically going to continue the cycle of diabetes, like what I said before. So, and it's not just macrosomal. There's the risk of preeclampsia, pregnancy complications. You can even have smaller baby. All right, that's
mhm,
also a complication. So we don't want to continue the cycle. We want to break this cycle. All right,
mhm,
and you need to do your part to make sure this doesn't continue, right? And then for gestational diabetes, after the period of pregnancy, those hormones return back to normal, and then your blood glucose, is stabilized. But then, like I said, gestational diabetes is your body giving you that sign that you might later develop diabetes in future. So what you also need to do is to make sure your HbA1c is checked regularly, and then also follow all this diet and lifestyle advice we normally give, like making sure you're physically active. I think ADA recommends 150 minutes of
of 15
moderate
minutes.
to intense physical activities in a week. Make sure your diet is healthy. Make sure you're limiting carbohydrates. Just eat healthy diets. Okay,
Mhm,
just
mhm,
eat,
mhm,
And yeah, I think you'll be good to go as far as you're being monitored. Okay.
Brilliant.
So yeah, I
Yeah.
think I've covered.
Thank you. I was just going to use that to say that we've tried to answer your question. Yeah, brilliant. Thank you, Whitney. She was asking about GD, which I believe is gestational diabetes, and that's what we have tried to do.
Yeah,
Uh,
yeah,
well, yeah, I think he said so. So GD could be a blessing in disguise to change lifestyle,
yeah,
right?
yeah. I think
That's
that's
what
the
it
best
means.
way to say it. It's a blessing in
It's just your
disguise.
body
Like
telling
body
you ahead
telling
of
you,
time that you need to
yeah,
be careful. Yeah, good.
yeah. And
So,
it's
so
it's
yeah.
very interesting, honestly, because again, just to really emphasize the fact that this is not what you're doing to yourself.
Mm-hmm.
I saw somebody who had GDM, and to be honest with you, when you see this person, you wouldn't think that this person would have diabetes. You
Mm-hmm.
wouldn't think this person could potentially suffer from type 2 diabetes.
Mm-hmm.
She wasn't a big person, like, as a healthcare professional, when we see some people we know. But it's just to tell you, she was just normal. I'm sure if they took a BMI, it was probably going to be normal.
Mm-hmm.
But then it's just to tell you that this is not what you're doing to yourself. Okay, there are so many factors involved. Genetics plays a very big role in it,
Mm-hmm.
honestly. All right. So yeah.
Thank you so much. I think finally we'll just talk about the difference, the secondary diabetes,
Mm,
the steroid induced, all these ones that come from pancreas, just for people to be aware of it as well, that these things can also happen,
exactly.
especially at different ages, you know.
Yeah. So yeah, I'll use this scenario to start off talking about secondary diabetes. So there was this person I saw. I'm trying to make sure like confidentiality is maintained
Mm,
and stuff like that. So let's just say this someone or this person developed diabetes, out of the blues,
mm,
no family history, nothing. And what did the person do on enteral feed, having a high carbohydrate feed going down into the stomach, and then before you know it, diabetes.
mm,
Okay, so this is not even what they've done to themselves. It's just
mm,
simply having feed down the gut. So, and that is a typical example of secondary diabetes. And what is secondary diabetes? Secondary diabetes is when an external factor comes into play in your whole body system, or when an external factor is involved with the normal functioning of your pancreas. Okay,
mm,
and this can vary. One can be like the example I gave if you're having a high amount of sugar, all right, and you're having it consistently, a very high amount of carbohydrates with sugar consistently, that can lead to secondary diabetes. The other one, like you said, steroid. If you're taking steroids, that can increase your body's resistance to insulin, thereby causing diabetes, and not just for a short period of time, over a long period of time. So if you're having steroid and it is continuous, speak to your healthcare professionals and get tested. Okay. Another one is if you're taking medications like antipsychotics,
mm,
antidepressants, usually, that can contribute to body's resistance, because you would have already found out that being on these medications, antidepressants, is making you gain weight. All right, and like we said, the more the weight around the belly, the more the resistance, and then type 2 diabetes. So that's another one. And some chemotherapy involves the use of steroid. All right, some chemo treatments have steroid in it, and that can increase your body's resistance to insulin. Okay, another one is alcohol. All right, people who drink a lot of alcohol, that can damage the pancreas, causing pancreatitis, and then leading to diabetes. So in that
mm.
form, you'll be treated like a type 1 because the
That's
damage
all.
was actually done to your pancreas.
Okay.
You see that? So,
Mm,
all right. So, and it can even go as far as trauma. If you have a
mm,
traumatic experience from like road traffic accidents, and then there's some kind of like a blunt force to the pancreas is completely destroyed. That can lead to secondary diabetes.
mm,
Another one is tumor.
mm,
Tumor to the pancreas, either malignant or whatever. Tumor to your pancreas can lead to diabetes, and that's also secondary diabetes. We call that type 3C diabetes.
mm,
That's the other name.
mm,
So, like I said, now it depends on how the external force is involved. If the external force is directly affecting your body's resistance, you might be treated with medications like metformin, if the external force is directly affecting the pancreas such that insulin production is depleted, then you'll be treated with insulin. So you either fall to, you fall to
It's still
either of
going to
this.
be either type 1 or 2
Yeah,
eventually. Huh?
yeah,
Yeah, that makes sense. Thank you so much. I think at this point we've really done justice to all the different nuances and sides to it. Well, on the surface, something we're trying not to go too deep into the technicalities of management of diabetes. Just want to keep it at what is important and what is necessary for the public to know, people who are living with it or people who are looking after those living with it. And we want
yeah,
to thank everyone who has joined us. We want to really appreciate all of you. With me, Boateng, thank you. And those who will be listening to this much later on, because again, I'm aware that
mm,
some people will not be live now. They will come up to listen to this later on. Thank you again for joining us. So we just want to ask, Pelumi, if there is any final words you want to say around this subject that we've
yeah.
discussed today.
I think in summary, it's just safe to say that diabetes has no respect for your age. It has no, it has no
Yeah,
respect
thank
for who you
you.
are. It
Yeah.
doesn't. I like to call it like a bastard disease. Like it doesn't care. From neonates, right? I hope you know that there is some kind of diabetes that happens to neonates as well.
Hmm. Is it the
It
type
happens
5
to
you're talking
neonates.
about?
No, I
No?
don't know
Okay.
whether it's type 5 or whatever, but
Okay.
I know the diabetes that happens to neonates, and that one is genetic. It's purely
Okay.
genetic. Tends to go as the child develops, but then that can be an early sign to say that the child might be diabetic in the future. So right from neonates down to even age 80, no pity. It doesn't say, oh,
Hmm.
you're old now.
You're
Let me
too
just
old for this, or you're too young for
that's
this.
too old for this. No,
It's you.
you can see somebody of over 80 having type 1 diabetes at that
Hmm.
age. All right. So it has no respect for who you are. But what you can do is to make sure you are, you are being proactive in the diagnosis, and also you are taking responsibility for the management.
Hmm.
All right. And
Thank you very much.
yeah,
Yeah.
that's it.
Yeah, thank you. I was going to, when I heard type 5, the type 5 is a recent one that the IDF
Oh really?
actually did it. Yeah, but the point I wanted to even make about that type 5 was when they were explaining how it happens, they said it's
Mm.
something related to malnutrition. So when the mom has suffered malnutrition
Okay.
while having before having the child, while the child is in utero, if
Mm.
the woman suffered severe malnutrition, that's like some of the ideas around it at the
So
moment.
malnutrition in what form? Is it like not having enough? Because malnutrition is either underweight or
Over,
over
yeah, on that way to this one of
underweight.
malnutrition that the mother, severe. It used to be before, but they took it
Okay.
off and then they're now bringing it up again. And it's
Mm.
something that they are, I think the bulk of it is coming from sub-Saharan Africa and other part of the impoverished part of the world. But the point is that even while the child is in utero, they're already suspecting. So just to buttress what you said, that from
Yeah.
neonate to in utero life, my God,
Mm.
it doesn't have respect for anyone, and that's
Yeah.
really why we
Mm.
must just do our best, and really just provide support. Again, it's just to make sure that if you see anybody who is managing diabetes by any means for any reason, give them the
Yes.
support that they need,
Hug
and
them,
I
hug
believe
them
I
and pat
believe
them on
that.
the back.
Yeah.
I say hug them and pat them on the back.
Honestly,
They are going
honestly,
through.
especially when you see them injecting it, or you see anybody with a sensor or anything, they are not
Yeah.
trying to be cool or to look. No, 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 no. Because I've had those conversations, my man. I've had people say that, what are you doing with this thing? Are you trying to? No, no, that's not it. That's somebody really struggling and battling with with their life there. So
Mm.
that's not just about being cool. Well, thank you so much again for this very insightful and very engaging, very informative section you've had with me, Pelumi.
Yeah.
And thank you for everyone who has also joined. We're going to just end it on this note, and we hope that we'll see you again some other time.
Yeah.
Well, you can also just check through. Eventually, this live will show the link to Pelumi's YouTube channel. He's doing a great job teaching and educating people on diabetes as well. Diabetes dot specialist nurses on Instagram, I believe.
Yeah.
Is it diabetes
Diabetes
dot specialist
special
nurses on
network.
Instagram? No,
Network.
network, yeah,
Yeah.
on Instagram. And here on YouTube, you would find a link to his channel on YouTube right here. So you can also just watch. And then if you also want to engage with my content, there's some diabetes related content there. And we hope to come your way again next time on this very station. Bye bye. Thank you very much, everybody. Bye bye.
Yeah. Bye.
Oh, hey. Oh, take charge, live well every day, every moment. Diabetes Wellness Foundation is here for you. Learn, thrive, stay strong, we rise